Today I'll be talking about an ACL tear and some of the landmarks and soft tissue structures that correlate with this injury. The first bony landmark is the lateral femoral condyle. The origin of the ACL is on the medial aspect of the lateral femoral condyle. Next is the medial femoral condyle. And the last bony landmark is the tibial tuberosity. Next, we'll talk about the soft tissue structures that correlate to the ACL injury. First, we have the hamstring muscles. These include the biceps femoris, the semitendinosus, and lastly, the semimembranosus. Now we have the quadricep muscles. These include the rectus femoris, the vastus intermedius, which lies underneath the rectus femoris, the vastus lateralis, and lastly, the vastus medialis. The last soft tissue structure correlating to the ACL injury is the lateral collateral ligament, or LCL. The LCL is found on the outside of the knee and helps with knee stability. Normally, if there's an injury to the LCL, it will be accompanied by another injury, such as an ACL tear. One form of acute treatment for an ACL tear is to ice the knee. You should ice the knee 3 to 4 times a day for about 20 minutes each time. Another form of acute treatment is to wrap the knee with a compression wrap or elastic bandage. This will help to reduce swelling. Some long-term treatment options include stretching and physical therapy. One exercise that can be done is standing on one leg. While standing, lift the uninjured leg up and stand with all of your weight on the injured leg for 10 seconds. This exercise will help you to build up your strength and balance. Next, put an exercise band around your ankles and while holding onto something stable, bring your injured foot forward and hold it there for 5 seconds. Then relax back to the starting position. Then bring the same leg out to the side and hold it for 5 seconds before bringing it back to the starting position again. Then you'll take that leg to the back and hold it for 5 more seconds. Repeat this process a few times in each direction. This will help to build up your muscles in your legs and increase your strength and stability. Two bony landmarks that we have when looking at the foot and ankle are the lateral malleolus, and on the other side of the foot, we have the medial malleolus. The soft tissue structure shown here is the Achilles tendon. This tendon connects the calf muscles to the calcaneus, or the heel bone. Lastly, we have the bony landmarks and soft tissue structure for the hip. First bony landmark is the anterior superior iliac spine. Next is the posterior superior iliac spine. And the soft tissue structure is the tensor fasciae latae.